incorrect position, the position of the person's patella that you do need to correct. So if you don't diagnose it correctly, you won't be able to use the taping technique the right way. You might be able to do the most perfect taping technique, but if you don't diagnose the initial problem right, it's not going to help your patient. Okay? You need coverall, which is, I did bring boxes around somewhere. It's a taller box. It's this white stuff. It does not stretch. Its basic purpose is that it goes between their skin and the other roll of tape, which this is called Leukotape, or generically a lot of people would just refer to this as McConnell tape. The name McConnell taping is the name of the technique. So this is Leukotape, this is coverall, they always go together. All right? And this is rigid, non-elastic tape. Right? So this is heavy, heavy, heavy-duty stuff. Rigid, non-elastic. So skin prep, if you want this to stick well, so it's best to have the area as clean as possible. So if you're doing any soft tissue work on the person and you're using lotions, then you're going to want to clean that area with rubbing alcohol or whatever you have. No hair is better. So if the person has a really hairy area, and this is going to be a long-term treatment thing, have them shave that part of their knee. All right? Or the first time they pull this off, that'll take care of a lot of the hair. Okay? Typically, you always will do 2 strips just to ensure you've got the whole area covered. So if you do need to make adjustments with this, or if there's 2 different positions you need to correct, you have the room to be able to do that with this. Right? This stuff is super, super sticky. It can create a lot of skin irritation. That's why we use this underneath. Okay? So, scissors. You will need scissors for both of these. Neither one of these you'll be able to rip by hand. Sometimes if you get a real cheap version of this, you can rip it. It'll have a little serration on the side. Usually you don't see that. Put your feet flat. Alright, so the first thing I'm going to do, I'm going to take this coverall. I need to know how much I need. So I'm basically going to be looking for 2 lateral points, midline of each side, and that's how far I'm covering. There's nice lines on the back of this, so I know I need a piece this long, and then I'll end up putting 2 that same length. So if you have the coverall on your desk, do that, and then just pass it on to the next desk near you.
I do not feel comfortable putting my. So you may want to find. You may want to find another part. Okay. Okay. Cool. I just don't want you to not get to practice it.
Yeah. No.
Okay. Here, do you want to record for me?
Do what?
Record for me. It's already recording.
Oh, sorry.
There are 2 strips. When you pull it off, just be careful, because if this sticks to itself, you pretty much got to start over and throw it away. So you want to be very careful as you peel it off, because it will want to stick to itself.
Playlist.
Then you want to find the patella.
Put on Facebook.
All right. One piece is going to go just a little bit proximal. One piece is going to go a little bit distal. And again, you're trying to overlap by about half. All right. There's no pressure. Just lay it right on the skin. You don't want to mess up. You want to come learn something? You want to come learn something?
Why we have no. I just want to say congratulations to Justin. Good job. Who's better than you?
Nobody.
Yeah, nobody in New England. Nobody in the Northeast.